Hi there, this is Nigel Howett from lawfulrebel.com. Just wanted to give you a quick update on a few thoughts on the coronavirus. So if you aren't locked down already in your country, you will be soon. Here in the UK, it's not quite complete lockdown, but very nearly so. The head of the Armed Forces, British Armed Forces Chief of Defence Staff, Sir Nicholas Carter, told us we'll have troops pretty much ready to be on the streets by the middle of next month. And apparently it could last 6 months. So with everything shut, we are seeing effectively an economic handbrake being applied. We are almost seeing a controlled demolition of the economy, which I'm struggling to make sense of, because allegedly this is to flatten the curve of new cases to prevent an astronomically high number of new cases, which would overwhelm the National Health Service in this country and the health systems of various other countries. But at what cost? A cost of collapsing the economy. We're looking at overwhelming a health system. To me, it seems more rational and sensible to do everything we can to support the health system, but not knock the economy over. And it's not even a done deal, or it's not even certain that this strategy of flattening out the number of cases is going to achieve much more than the demolition of our economy. So it really makes me wonder whether we've got our priorities right. I think it's really important to keep this whole coronavirus situation in some kind of perspective. And to that end, I think it's really important to notice that there's some figures here from 2017. Around 56 million people died that year, and 17.8 million of those deaths were from cardiovascular disease, something that the government champions our high processed carb diet, our high sugar diet, and doesn't seem to be quite as concerned about the number of deaths of from cardiovascular disease. There's a lot of evidence out there as to what causes it. Of course, it's all denied by the mainstream, which just pushes on as usual. Cancer caused 9.6 million deaths in 2017, yet from the state's perspective, it's illegal to practice alternative means to cure cancer. You're still only allowed to officially use radiation, chemotherapy or surgery. This is how much the state is concerned about those cancer deaths. Respiratory diseases such as coronavirus caused 3.91 million deaths in 2017. Even road accidents claimed 1.2 million deaths. So at the moment, we're at the time of recording, this is Monday evening, and we're looking at around about 11,000 deaths so far. So just trying to keep this in some sort of perspective. And according to a report from the World Health Organization, in 2016, more than 3 million people died as a result of harmful use of alcohol. So it's really important to keep this in perspective. We also have to note that the death rates are being skew-whiffed. They're not, they're misleading. And this is because they're arriving at a death rate by looking at total deaths as compared to number of confirmed cases, which obviously, with the limited degree of testing going on, is going to give you an artificially high death rate. Whereas when you compare to the cases of flu, for example, the annual cases of flu deaths from flu ranging from about 290,000 to 660,000 per year, this takes into account all estimated cases. So this is again important to bear in mind. We also have to remember that we've heard that in Italy, 99% of those who died from coronavirus had other illnesses. They had other underlying health problems, chronic issues. They had a compromised immune system. This is really important to bear this in mind, to really get a handle on how dangerous this thing is. And we also have to question the testing. How efficacious is the testing? How accurate are they? We know that from testing HIV, there were many false negative and false positive cases. So there's a whole lot of unknowns about this, but we do know that the propaganda is very much trying to get us to take it seriously. Take a listen to Dawn the health worker. This was published by BBC on the 20th of March.
I'm a critical care nurse. I've just finished 48 hours of work. I just wanted to get some stuff in for the next 48 hours. There's no fruit, there's no vegetables. I just don't know how I'm supposed to stay healthy. And those people are just stripping the shelves of basic foods. You just need to stop it. Because it's people like me that are going to be looking after you when you're at your lowest. Just stop it. Please.
Seems strange that they're trying so hard to get us to stop panic buying, because you can't panic buy now, even if you wanted to, and you haven't been able to for 3 weeks because the supermarkets are not letting anybody buy anything in bulk. So not quite sure where that's aimed. But we've also got stories like this 39-year-old Tara Jane Langston. Check this clip out.
This message on Instagram from her bed in the intensive care unit of Hillingdon Hospital in London.
Please, none of you take any chances. I mean it. Because if it gets really bad, then you're going to end up here. And my body is fighting this. I've not seen Richard, I've not seen the girls since Friday, and I'm just going to fight this.
These sorts of things should not be BBC News. This is blatantly pulling emotional strings. It's appealing to your emotions, and it really hasn't got any part of a main headline news programme. I think this is very telling. We need to be very aware of our mainstream news sources pulling at our emotional strings. But it does seem to be clear that we're being encouraged to take this very seriously, the fear of this coronavirus pandemic. But is it really as serious as they're being made out? Obviously some people dying and suffering, and that's always bad news, but we do have to keep it in perspective. And bringing down the entire global economy in the name of saving a vast number of old people dying and people already with compromised immune systems doesn't seem a proportionate response. So if we look at the big picture, the underlying state of the global economy is in a drastic state. Collapse has been mathematically inevitable for some time, and it's rather convenient that coronavirus is being used as the justification to literally just pull the handbrake up on the economy. We are absolutely locking down economic activity, and the consequences are inevitable, and it's unlikely to go away anytime soon. In the UK, they're talking about paying people's salaries for a while, and again, this is a fantastic pretext for unprecedented levels of state intervention in the economy. All really, really dangerous signs, ladies and gentlemen. And we've also got 5G being rolled out. There are indications that they might try and increase the rollout of that, since everyone's working from home, greater desire for connectivity and bandwidth and all this good stuff. So there's a number of things going on here, but what we can see is that the globalist agenda, the agenda that has been known about for anybody paying attention and looking at these stories for many decades, we've known about this. There are those who would like to see a one world government, a collectivist sort of model for society across the whole world, and this agenda is moving forward at a tremendous pace in the wake of this coronavirus outbreaks. So we have to be very suspicious. Remember, there's a credible amount of information that this is a bioweapon. So we have to bear all of these things in the picture. We have to consider this as all part of the context. So laws and regulations are being changed at the drop of a hat here in the UK and around the world. The BBC have mentioned things like detaining people under mental health law, possibly for refusing their compulsory vaccination when that comes out. The Danish government already passed laws to okay compulsory vaccination. They're just around the corner in your country too. Make no mistake about that. Gordon Brown on the BBC last Friday also mentioned about how worried we are of this recurring. So you can be sure this isn't the last pandemic that you'll hear about. You can be sure that this is just another one. We're already familiar with bird flu, H1N1, swine flu, Ebola. You know, we've seen all of these pandemics, and we've seen how they've enabled and justified legislation to be put into place, which is now conveniently in place to deal with this pandemic, and there will be more because they're just so convenient for removing freedoms and increasing the control and power of the state. This is really important to be aware of. So we're going to see more control of the economy, more welfare state, more socialism. We're already seeing jury trials here in the UK being banned. Okay, temporarily, but again, it sets a precedent, doesn't it? Jury trials are a cornerstone of the British justice system, and you know, the globalists and statists would love to see jury trials conveniently unable to carry on, and here we are. The World Health Organization refers to this not only as a pandemic but an infodemic. There's a war against all of the alternative media and people like me talking about alternative stuff about how to be healthy. There's a clampdown going on against all alternative media, giving us extra additional alternative information on how to be healthy, all of that sort of stuff. Censorship is being ramped up, and things on YouTube that have been up for over a year with the adjusted algorithms are now being taken down and found to be unacceptable. You know, the guise is that members of the public are being protected from harmful false information. You know, this is just censorship, ladies and gentlemen. So your favorite alternative media channels, make sure you can source them directly from website, because they're going to find it harder and harder to get onto YouTube and other platforms. So one thing I find very, very suspicious, being somebody that's talked about health for a few years now, is that there's a big contradiction, because the state, our governments, are all acting under the guise of for our health. This is supposedly to save lives, for our benefit. And yet, when you look at the state's track record on health, it's absolutely appalling. The state has never cared about your health. This is really important. There's absolute disregard for the dangers of things like mercury amalgam fillings, completely ignored. Fluoride in tap water, promoted by government, all of the cautions ignored. EMFs and 5G, all of the cautions on health, the facts are on the record. Anybody can look it up. There's plenty of information on lawfulrebel.com if you want to check it out. The governments are absolutely disinterested in protecting your health by going easy on EMFs and re-looking at the non-ionizing effects of EMFs. Glyphosate in the environment. This is the real environmental disaster, never mind CO2. Glyphosate's a water-soluble antibiotic. It's a disaster that it's released in the environment to the extent that it is, in the watercourses, in the rivers, in the rain in a lot of countries. This is wrecking people's gut, and it destroys the integrity of the gut through leaky gut, and it's wiping out and seriously threatening the ecosystem. What does the government do about that? Nothing. So when you bear in mind this, with the whole myths about diet and the government's lack of care about us eating sugar and processed foods for the last 40 or 50 years, you have to wonder now at this huge concern for everybody's health, particularly, again, as we mentioned, that it's mainly elderly and infirm people and people with immune compromised conditions. But here's the big kicker: you'll not hear any advice on how to prevent your body succumbing to coronavirus. You won't hear anything about antivirals. You won't hear anything about taking extra vitamin C, about supporting your immune system with things like nutritional ketosis, getting a good night's sleep, avoiding EMFs particularly in your sleep state, the deep sleep state, you won't hear any advice. There's plenty on lawfulrebel.com, by the way, but you won't hear any in the mainstream media or from your governments. And this is a major contradiction that we have to, again, be aware of when we're trying to make sense of the situation that we find ourselves in. Because it's important to remember that the only way to fight a virus, in spite of the propaganda we've been hearing on the BBC News here about how the army are here to help us fight the coronavirus, which is absolute nonsense. What can troops on the street possibly do? The only way to fight a virus is with a healthy immune system. But as we've mentioned, you won't get any advice about that. We're encouraged to fear this virus. We're almost being encouraged to clamour for that vaccine and to welcome the state interventions of propping up people's salaries and protecting them from this virus, which, as I said, the only means of protection is a healthy immune system. There's never been a better time to get interested in being healthy if you haven't begun so already. So thanks for listening. I hope you find this helpful. And check out the website lawfulrebel.com, and stay safe and be wary of the advancing powers of the state. Take sensible precautions to safeguard your health, but don't be in fear about this coronavirus. The far greater threat is to the handbrake that's being applied to the economy, this controlled demolition of our economic system that's frail and indeed ready to fall over anyway. And all of these sweeping state powers that are coming in on the back of it on this pretext, that's the real threat, ladies and gentlemen. That's the real threat, ladies and gentlemen. Thanks for listening.